I'm Robert Hayne, I'm one of the ENT consultants in East Kent. I work primarily out of the William Harvey and Kent and Canterbury Hospital. I subspecialise in general ENT conditions, thyroid and head and neck surgery, and I run my private practice out of the One Hospital in Ashford. Rhinosinusitis is a condition where the lining of the nasal cavity and your paranasal sinuses is inflamed. There are four main symptoms of rhinosinusitis, which you can need two of to have a diagnosis. You must have at least one of blockage, congestion of the nasal cavity with discharge from the nose, and that can be from the front or back. On top of the obstruction and discharge from the nose, you may or may not have loss of sense of smell or pain in the sinuses themselves. It can be graded as mild, moderate or severe, and it can be either acute or chronic depending on its duration, and up to 10% of the population can suffer with rhinosinusitis. So there are a number of causes. The most common are infective causes, and these can either be simple viruses, just like the common cold, to bacterial infections or even chronic fungal infections. There is a role for allergy within rhinosinusitis itself, although that breaks out into allergic rhinitis rather than sort of chronic rhinosinusitis, and that's graded slightly differently and treated differently. There can be genetic causes, there can be structural causes such as bent nasal septums causing blockage on one side and blockage of the drainage pathways. Other causes can include vascular causes as well as degenerative changes in the nose just from old age or problems with the cells themselves. There are also vascular causes, or even certain medications can cause rhinosinusitis, such as overusing decongestants or even certain drugs. So the treatment is based on the cause, and it also depends on whether it's acute or chronic. The mainstay of treatment is simply to reduce the inflammation within the nose itself, and the mainstay is using an intranasal topical steroid. Now, this isn't systemically absorbed, and it generally just remains on the lining of the nose and reduces the inflammation. There are a number of other treatments you can give in conjunction with this depending on whether it's acute or chronic, and whether it's allergic or not, and what the underlying cause is. So for instance, if it was bacterial, you may wish to include antibiotics, or if it's allergic, you may wish to include antihistamines or some eye drops to stop the irritation and itching, as well as reduce the inflammation from that point of view. A nasal douche, which is simply a saltwater wash to put up the nose itself, helps remove the mucus and help reduce the congestion as well as some of the irritation within the nose. And the steroids may, if your symptoms are severe, be converted to either drops or even tablets. If your symptoms are not controlled on intranasal steroids, you can go for surgery, but I would always recommend a trial of maximal medical therapy before you proceed to surgery. So before your surgery, you should obviously see an ENT specialist, and you should trial maximal medical therapy. After that, you would probably have a CT scan, which is a scan of your nose and sinuses to have a look to confirm whether or not there's inflammation within the sinuses, and look at the anatomy of the nose before your surgery. Surgery is all done what's called endoscopically, with cameras through the nostrils, and the surgery itself is called functional endoscopic sinus surgery. Well, there are a number of different techniques, but it essentially involves opening up the sinuses to help the drainage of the sinuses so that the excessive mucus can drain out, as well as getting the medications into the sinuses to help reduce the inflammation. If you have any symptoms or signs of chronic rhinosinusitis or any concerns about your nose in general, please feel free to see your GP and get referred to the One Ashford Hospital, or I'm happy to take self-referrals through the hospital as well.